Well, hello and welcome to all of our Gold viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, a very special welcome to you today, and we have Dr. Brigit Carter with us today. We're going to be chatting with her in just a minute. We are talking about our upcoming Gold Neonatal Conference just around the corner here, actually starting on May 26th. So do join us for our opening keynote with Dr. Michael Narvey on that date. And Dr. Brigit Carter is going to be with us for a main program as well, and talking about the evaluation of assessment strategies to reduce risk associated with feeding intolerance. So this is going to be a good topic as well for all of you, those of you who are listening in who are working with our little neonates, and of course, just looking at long-term care, what happens when they come out of the NICU too, and how this might impact them. But let me introduce to you right now Dr. Brigit Carter. Welcome, Brigit. It's so good to have you here at Gold Neonatal.
Thank you so much. It's a fabulous day to be here and to talk about our little neonatal
Yeah.
premature infants. Yes.
Absolutely, absolutely. Well, again, I was just talking and sharing a little bit about you. I saw that you actually retired from the U.S. Navy as a commander in 2018. So again, thank you so much for your service. You've 28 years. That's incredible. What a journey that must have been for you. And so now you're retired, but what does that really mean? I know you're still, what does that retirement really look like, right? So why don't you share with our audience a little bit about your career, where you are in the world, and some of the loves that you have?
Absolutely. So my career in the Navy started when I was 17. I was an enlisted personnel stationed on a ship out of Mayport, Florida. And at some point in my career, I decided I needed to continue to develop myself. And that's how I ended up in Navy nursing.
Oh, wow.
So went back to college and got my nursing degree. Decided to get out of the active duty side of Navy
Hmm.
and went into reserves,
Sure.
but finished my career as an officer. And that was very exciting to be able
Mm,
to support the neonatal units because
wow.
they have 4 neonatal units in the military for the
Hmm.
United States Navy,
Wow.
and to bring some practices to them that I was,
Sure.
doing research on. So it was really exciting.
Wow.
I'm currently in Durham, North Carolina. I'm at the Duke University School of Nursing. I
Hmm.
continue to work in the neonatal intensive care nursery because I love doing research in the unit and I love knowing what problems that are going on
Sure.
currently in the unit. So
So it's a,
being,
yeah, I was
go
going to
ahead.
say it's a little bit of a trade-off then for you as well, because you're actively working and you're actively teaching and research, right?
Exactly. So I think it all blends really nicely together. My students like to know what I'm doing. It
Mm.
also helps me prepare them for research or quality improvement projects. And I think it all blends very nicely.
That's very nice. Yeah, I can appreciate and understand. Sometimes it's really hard to be completely academic, and I know I can already tell Bridget how much you love those little neonates, and how passionate you are about practice. Because really, this is a lot of what you're talking about, I believe, in your
Mhm.
presentation.
Yes.
And again, the title: Evaluation of Assessment Strategies to Reduce Risk Associated with Feeding Intolerance. So tell me a little bit about why this particular topic became a focal point for you particularly.
Yes. When I first came to my unit, I just noticed that there were so many infants who had feeding intolerance. I think
Hmm.
we all know that as neonatal nurses.
Sure.
When I decided to get my PhD, I said, I'm going to go ahead and research necrotizing enterocolitis and
Yeah.
look at some of the contributing factors that are related to that. But after I finished my doctorate, I realized I needed to take a step back because
Mm.
necrotizing enterocolitis was kind of the end point. So
Right.
what happens before the necrotizing enterocolitis begins? And we all know that the feeding intolerance is one of those things that leads up to this.
Right.
And I'm only speaking of the most common, not the quick intestinal perforations, but
Sure.
really, the ones that lead up to this slow demise of the gastrointestinal system.
Right.
So that's one of the things. It was just really, I just saw too much of it. I wanted to make a difference for our
Yeah.
infants and our families, which this is a very stressful event every time a feeding gets stopped.
Yep.
And so I just really felt like I could do something as a neonatal nurse, and the
Mm,
research is where I'm at and trying to devise some. We'll talk a little bit about my research
mhm.
and how I want to measure intra-abdominal pressure um, to be able to determine whether or not an infant is moving towards feeding intolerance, so we can
Right.
catch them early.
Yeah, yeah. This is so interesting. I'm just hearing some of the points that you made, in terms of really this was prior to necrotizing, encephalitis. And so, it's sort of even before, like, let's look at what
Mhm.
actually might be causing this, some of the concerns, and then even talking about the parents and how their response plays a part in this as well. I'm sure you've had many meetings with families where there's
Mhm.
disappointment and concern and fear, all wrapped into this as well. And is this something that you still are managing in the NICU as well with your nurses and your families?
Well, whenever I go to work in the unit, I
Mm-hmm.
think it's always a concern. One of the last infants I took care of a couple of weeks ago was, they were having some back and forth with feeding. And
Right.
we finally got on a good path, and that day was a great day, and the
Mm,
infant was tolerating feeds. And so it's just really wonderful when you can share those experiences and talk families through what is something to be concerned about and what's not.
mm-hmm.
Things have changed over the years, things that we like residuals, for instance, that we are so concerned about years ago. Like
Right.
you would stop feeds if they have residuals. And
Right.
now a lot of units are feeding through it because the evidence shows different things than what we understood before.
Yeah.
So that's why research is so important, because in
Absolutely.
order to advance how we treat these babies, we would not be able to, you know, do that.
Yeah, absolutely. Speaking of timelines, so you've been in this field a little bit of time now, right? So, uh,
Yes, yes.
I mean, you've got to have seen some of the change, obviously, that's happened even with research. Do you feel like we're still fairly progressive, or do you want to see more? Like, where's your gut in all of this right now, Bridget?
Yeah. I really love that every time I go to search the literature, I see so much work being done in our area in all different fields, whether it's
Hmm.
respiratory or cardiovascular. I think we have a phenomenal amount of research going on, a lot of, hospital and academic medical centers who are contributing to that research. I really feel like we're progressing nicely. Just the research that I do for these discussions,
Hmm.
is I have to go deep into the literature and see how we're progressing every time. And it's something to know that we are moving forward. There are
Sure.
still things that we don't know about. We have a very vulnerable population. Certain
Hmm.
things cannot be researched, so we have to learn about them over time.
Right.
And so those are, one of the things is necrotizing enterocolitis. You can't stop providing something for an infant if you think it will be a good for them. For instance, probiotics. We
Right.
know that this is a good thing, so you're not going to put someone in a randomized controlled trial to see
Right.
if it works or if it doesn't work. So you just
Yeah.
have to, monitor for longer
Sure.
periods of time.
Yeah.
But
No,
we're making great
absolutely.
progress in this field. I remember just when I started how far we've come in feeding and reducing hospital stays because
Hmm.
of, not stopping feedings as often as we used to, and infants are growing better, reaching their birth weight sooner.
Right.
So yes.
Yeah.
making progress.
Making progress, that's what it's all about. And I think too, if you look at the literature and how much has even gotten out into the public eye, so to speak, there's a lot more exchange of information.
Mhm,
Perhaps the internet, of course, having
mhm,
played a role in that as well. But I think overall, NICUs, I think every time I talk to someone working in the NICU, they really feel like the field itself is getting better recognition, more funding perhaps, and so therefore that means that we can move it forward, because of that as well. And it just seems that maybe sometimes, those little preterm babies weren't maybe as valid, in our culture or society, but we've got an increase of preterm infants. So possibly that has played a role as well.
Well, I think unfortunately there's some areas that we haven't made tremendous progress,
Right.
especially with minority populations and preterm birth.
Absolutely.
So we still have areas that we need to understand better why these relationships exist between minorities and delivering infants preterm or prematurely. And
Right.
we do need to have a better understanding of why that happens. It's
Yeah.
one of those very difficult relationships to prove, and we can
Mm,
hypothesize,
yeah.
but it's something that we'll continue to work on, and will be something that people will continue to investigate. That's one of the
Absolutely.
areas that I looked at originally, was
Mhm.
what were the contributing factors,
Mhm.
maternal wise,
Right.
and women who are at risk for infection or have had infections,
Mhm.
we know that they are at higher risk for delivering preterm.
Mm.
And then for those infants to have also, higher risk outcomes,
Mhm.
associated with necrotizing enterocolitis and some other disease processes.
Yeah.
But,
Boy,
the
there's a lot to be done, right?
there is a lot to be done. We will never stop working and moving
No.
towards, the progress that we're making is wonderful, but there's always so much more research. Once you answer one question, there is always another one pending.
Yeah, absolutely, absolutely. Well, I'm really looking forward to hearing more about this topic, Bridget, because I know that you're going to be talking about what we do now for our assessment of an infant,
Mhm.
and what possibly we could do in the future, or some of the things that we're progressing towards. So this is going to be a great presentation to learn about all of those different values. So thank you so much for bringing this to Gold Neonatal. It's going to be a great day of learning. You're going to be with us on Monday, the 1st of June. So all those that are listening in today, I know some of you are in different time zones, so be sure to check out the website at goldneonatal.com. You can check out the time, the day that you're going to be able to come and listen to Bridget. But Bridget, you're going to be with us here live. You'll be answering questions as well. So if folks have real-time questions, they'll be able to come and meet with you on the day, and we'll get into some of those answers just right after the presentation as well. I know you're looking forward to answering some of those questions as well, right?
I am so excited. This is my favorite thing to do, so I am looking forward to having these conversations with each one of you.
Oh, fantastic. Well, thank you so much to Dr. Bridget Carter for being with us here today. And of course, to all of you, our viewers, don't forget to join us for our opening keynote on May 26th with Dr. Michael Narvi, as well at goldneonatal.com. And you can register for the full conference there. We'll look forward to seeing you all then. Bye bye for now, everyone.
Bye bye.